The aha moment for ophthalmology came in medical school. The confluence of neuroscience, surgery, innovation and engineering, as well as, most importantly, happy patients and happy physicians. And so it was an absolute no-brainer as to what I wanted to do with the rest of my life. I'm a vitreoretinal surgeon, which means that I care for both medical and surgical diseases of the retina, such as age-related macular degeneration, diabetic retinopathy, things such as epiretinal membranes and macular holes, all the way to complex surgical diseases such as complex retinal detachment repairs, intraocular hemorrhages, dislocated intraocular lenses, as well as ocular trauma. So the patients that I see are many and varied. I see patients that are young, as well as patients who are very old. The first thing that I try to make sure is that I establish a good relationship with them. I try to get to understand who they are, what their goals, what their desires are for their health and for their vision. And then the second piece comes from really understanding what is their diagnosis and getting to the heart of that. That may take more than one visit. Sometimes additional investigations need to be undertaken, such as imaging, blood work, genetic testing. And after we've gathered the appropriate information and history, we then try to talk to the patient about what precisely is going on with his or her eye and what potential treatment options there may be, as well as a very detailed conversation about the risks, benefits, and alternatives. Some conditions require in-office procedures, such as injections into the eye. Some conditions require surgery in the operating room, which we provide over at the Cleveland Clinic main campus. But some cases may not require any kind of active treatment and may require just observation or following along. Being able to arm them with, first of all, the knowledge and understanding of what's going on, and when possible, to actually be able to restore some of their vision, or at the very least, to prevent it from getting worse, is immensely satisfying. What's going to be provided is ideally the highest level of care that's known to modern medicine. It's really something special to be part of ophthalmology and being able to have long-term relationships with patients. I've gotten to know some of the patients' families, and they've gotten to know my family. Well, when I'm not at the hospital, my wife and I have two wonderful young children who really occupy most of our day, but also fill us with a lot of fulfillment and joy.